Hi, my name is Bill Croson, and I practice pain medicine in Coos Bay, Oregon. I want to talk to you about regenerative medicine treatment using platelet-rich plasma and stem cells. First, I will give you some background information, and then I will show you how to make good platelet-rich plasma for a reasonable price. Before I did pain medicine rotations during my training, it seemed like pain was a subject to avoid, as patient satisfaction was hard to achieve, even with opioids. Then I learned that there was something that we could do that was medically safe and sound. With X-ray guided steroid injections and radiofrequency ablations, we could give people relief, sometimes for years at a time, often allowing people to get by without using opioids. But degeneration still occurred, whether from injury or from aging. Platelet-rich plasma and stem cells offer a similar improvement in treatment because with these, we can slow the progress of degeneration. The body has an amazing ability to heal itself in the event of injury, and this is described as a three-step process: inflammation, proliferation, and maturation. With inflammation, the injured part of the body can attract platelets and stem cells, which release growth factors that encourage proliferation of tissues needed to heal. In theory, anti-inflammatory drugs, including steroids, can stop the healing process by stopping the first step. Due to aging or re-injury, the body can get stuck in the inflammatory phase. In addition, the tissues and cells in our body are, in a way, programmed to degenerate and die as we age. Cells stop replicating, the tissues shrink and atrophy, becoming less elastic and more brittle. These changes often lead to arthritis. With PRP and stem cells, we can mechanically augment the body's own healing process and reprogram injured and aging tissue to heal as it moves past the initial step of inflammation, leaving it better able to withstand the ongoing strain of normal function. In spite of how much sense PRP and stem cells make, insurance coverage is very limited. When I heard that the VA was covering PRP injections, I was excited to be able to offer this treatment to veterans. At the time, we were using a kit from a reputable orthopedics equipment supplier to make PRP. The kit cost us $225, while the VA only paid $175 for the whole process. For this reason, I wanted to find a way to make PRP without the kit in order to make it more affordable. And here's how I do it. This article has a good review of different protocols, which helped with choosing centrifuge time and speed. This book is a good reference and review of theory and research. We use syringes instead of a kit. The pressure on the syringe from spinning it in the centrifuge will cause weaker syringes to leak, and so we use these, which have never leaked in our experience. We use ACDA for an anticoagulant, and in a 10 milliliter syringe, we draw 1 milliliter of ACDA. In this example, we will prepare about 6 milliliters of PRP, which will require 6 syringes. Draw 9 milliliters of blood for a total of 10 milliliters in each syringe and gently mix the blood and ACDA. A large bore needle for drawing blood will have less chance of mechanically damaging the platelets. Options for phlebotomy needles are limited, and so drawing with low and steady pressure will help. A vacuum tube applies a lot of pressure and may contain chemicals that you don't want to inject into the patient. Withdraw the plungers to the full volume of the syringe, and then cut them off at the base of the syringe. Save one plunger for later. Weigh the syringes in the centrifuge bucket and add a little water if needed to balance the buckets. Place the buckets in the centrifuge. Do the first spin. Consider the centrifuge radius when calculating the RPM or G-force. My centrifuge has a 6-inch rotor radius. When the centrifuge is done, then carefully remove a syringe from the centrifuge bucket and attach a microbore extension tube. Eject the plasma into another syringe and retain the red blood cells. I eject the plasma into 6 milliliter syringes. Minimize the amount of red blood that enters the extension tube. Dispose of the remaining red blood. Now there are 6 syringes with plasma that contains platelets that are not concentrated. Withdraw the plungers and cut them off, saving one for later. Weigh and balance the plasma syringes in the centrifuge buckets. Place the buckets in the centrifuge. Do the second spin. Notice that this one takes a little longer. Remove the plasma syringes and notice the platelet pellet at the bottom of each syringe. Attach a microbore tube and eject all but 1 milliliter of the plasma. You can dispose of the bulk of the plasma as the platelets are in the remaining 1 milliliter in each syringe. There are beneficial substances in the plasma, but we will not try to extract those in this video. Eject the last 1 milliliter of the plasma with the platelet pellet into the syringe that will be used to inject the patient. Notice that part of the platelet pellet remains in the tip of the syringe.
It's like, maybe we'll wait till there.
This is a small volume, but it is concentrated platelets, and so I use a 25 gauge needle to withdraw the remainder of the pellet from the syringe and then add that to the final product. This is the final product. The transfer of plasma between syringes and tubes resuspends the platelets. I inject the final product with a 27 or 30 gauge needle and find that the product flows slowly but smoothly and never clogs the needles. We sent samples of our product to the lab to compare with the product made by using the orthopedics kit. And we got a lot more platelets using our syringes than we did using the kit. We noticed that the product from the kit had a visible layer of red blood cells, and lab results showed that we had virtually eliminated the red blood cells using the syringes. This is important as red blood cells in a joint can be toxic to cartilage cells. They will increase inflammation and they can contribute to arthritis. With this technique, we are able to offer PRP for a more reasonable price, and we can afford to provide this service to veterans. Although the product that resulted from use of the orthopedics kit does provide benefit, it would appear from our lab results that we are able to make a better product. Our technique is more labor intensive, and so in a busy practice where affordability is less of an issue, a physician could provide this service to more patients by using the kit.